Hi, and welcome to the Holistic Entrepreneur, where we explore the intersection of healing and business. I'm your host, Zane Myers, and on each show, we spotlight a specific healthcare practitioner who takes a more natural approach to healing while building successful businesses along the way. From functional medicine doctors to naturopaths and acupuncturists, our guests share their unique health philosophies and real-world challenges of entrepreneurship. Whether you're a patient or a practitioner, you're about to hear insights that honor both the healing and the business success. So I'm here with Dr. Ilya Skolnikoff. Also, I've nicknamed him Stolyarkov or Stolnikov.
Yeah.
And he's a functional medicine doctor, best-selling author, works on inflammation and functional medicine. He's lectured all over the world, has been on every kind of TV show imaginable, and he's got some great stories to tell you. So, how did you end up getting into? Yeah, I know that into functional medicine, into chiropractic. Your dad was a psychiatrist, and your mom was an anthropologist.
Yeah.
And then you go, well, Dad, I'm going to be a chiropractor, and he's, not thrilled. How did you decide? Geez, this really sounds like something I want to do.
Well, my father, I'll show you. I think there might be a picture of my father here. So yeah, my father was a psychiatrist, and then I'm going to show you a picture of him here in a second. So one day I came home and I told my father, hey, Dad, I figured out what I'm going to do for a living. I want to go to chiropractic school and study to become a chiropractor. So he says, okay, well, can you actually make money doing that? Those were his exact words. Can you actually make money doing that? Oh, I don't see it here. Hold on a second. I said, well, yeah, Dad, actually some chiropractors do really well and make even more money than you do. Looks like I don't have the photo, so I'll stop sharing, I guess, because there's no reason to do this. And he says, okay, well, that's good then. So to my father's credit, he paid for my entire chiropractic school education. But I can remember there was a great deal of conflict in our conversations. Like, we'd be sitting down to eat, and my brother, who's a marriage and family therapist, would really connect with my dad, and they would have a great time talking about psychology. So I also provide emotional therapy. So I said, hey, Dad, have you ever heard of David Hawkins's book, Power versus Force? We were just talking about it. So he's the well-known psychiatrist who talks about muscle testing in his book and how it can be used to raise a person's level of consciousness. It's amazing. He says, well, that is very interesting, son. Haven't heard of it. But that is a very interesting theory. I said, okay, well, what theory, Dad? This he actually had diplomates of the International Board of Applied Kinesiology right there in front of him. And he was performing muscle testing for nearly 20 years. And he was able to determine very deep and vital things about human consciousness. In fact, he travels all around the country and lectures about this. He wrote 9 books about it, developed an entire map of human consciousness. Why is it a theory? He said, well, son, I'm really not all that. I don't really believe in all that, but I think it's an interesting theory. I said, okay, Dad, you don't believe that he developed the map of human consciousness? You don't believe in the muscle testing? What don't you believe? And what's with the theory anyway? He said, well, I'm really not interested in all that, but I'm glad that it's something that interests you. I said, oh, okay, well, you're a psychiatrist. Dr. David Hawkins is a psychiatrist. I thought you'd be interested, Dad. Why aren't you interested? He said, well, I'm closed to this subject. I'm not interested. And that's my final word. I said, okay. No problem. It's okay. Okay. I understand. What about the great epigeneticist, Dr. Bruce Lipton? Have you ever heard of Dr. Bruce Lipton, Dad? He's the guy who taught at a medical institution for like 10 years. He said that we can change our genes. He developed epigenetics. I said, no, son, I haven't. Well, he wrote that book, The Biology of Belief, and he also travels around the country and lectures about that and some other things. And he figured out that we can change our genes by changing our thoughts and feelings, beliefs, attitudes, and environmental stimuli. He taught molecular biology to grad students for about a decade or so. Oh, son, that is very interesting. That is a very interesting theory. What? It's like, what theory, Dad? This guy's a highly regarded medical school instructor who taught at a medical institution for like 10 years. It's not just some theory, Dad. Epigenetics is the cutting edge thing. Everyone's talking about it. How the genes express themselves can be altered, and it's been researched over and over again. It's not just some theory. He said, well, that is very interesting, son. That is a very interesting theory. There was this other time where I showed him these amazing success videos like I showed you earlier. I could show it to you again. I could, even though
I want to go back to that success video because that was because I want to, because the other people who weren't here earlier didn't hear that. And I thought, to me, that was so fantastic. The young, you told me about a young person who came into your office and was coughing 30 times a second. And you said, oh, I cured him in the one office visit.
Well, I helped his body. I helped him to heal himself. Your body heals itself. So I didn't. Healers don't cure. Our bodies heal, and they help remove the barriers to healing. That's what a good healer will do. They can identify something that's imbalanced, and then they can allow healing to take place. But they don't actually heal. It's kind of a misnomer. You wouldn't call it that person a healer. You'd call them like a facilitator or something like that. They're just technicians. But
so
yeah.
So can you share that video again? Because I think that was so. You had somebody come into your office and he was coughing 30 times
a minute,
which sounds almost unbelievable. And then you had this effect
from through the therapies that we were doing. Yeah. So this is the Santos family. This is Michelle Santos. This is Dylan Santos's mother. And we're going to hear Dylan's story of how we helped him with his asthma in one single treatment visit that he'd had for more than 10 or 12 years. So here's the story.
And then I brought my youngest son because he has asthma. And after the first visit, he was off all of his medications. He was taking 2 inhalers, a nose spray, eye drops, and a pill every day for his asthma for the past 3 years. Dylan was diagnosed with asthma when he was, let's say, in 6th grade. And he's been suffering seasonal asthma since then. So each time that he would not be feeling good, which would be like lethargic and tired and just not able to focus at school and irritated by everything, we'd go to see the doctor, and the doctor would put him on another inhaler or another prescription. So by the time he got to 9th grade, he was on 2 inhalers, a nose spray, eye drops, and a daily like Claritin or something like that. And he just felt he was getting sicker and sicker. And I kept taking him back to his physician, and he sent Dylan to a psychiatrist because he thought that Dylan was it was more a emotional thing than it was a physical thing. And as a mother, I knew different, because he's my son. So it was very frustrating with him, very frustrating. And he missed so much school because he was so sick. And now he's been seeing Dr. Ilya for about a month and a half, and he's off all his medication. I mean, I think it was the second visit, he was no longer on the first visit. He just stopped taking his medicine and started taking nutrients. And he has, he's been through a lot of healing where it's taken him a little bit of time to get to the health part, but now he's there and he's a completely different child. He feels good. He has a lot of energy. He's back in school. He's trying. He cares. Just not a lot of fatigue. It's just been incredible.
I'm Dylan Santos, and I'm from San Rafael, and Dr. Ilya has changed my life so much. I was coughing every like 30 times in like a minute. It was like just deep, dry coughs that were just annoying. When I was like working, I couldn't concentrate. And then Dr. Ilya, when I met him, he like gave me some nutrients, and then it just made my natural flow just to make me stop coughing. And I'm just so happy for that. And my asthma was like, when I coughed, that my asthma made it worse. And like, it was like, I had an asthma attack when I was running, and then now I like breathe normally now, since I've seen Dr. Ilya. And it's just insane. It's just been like 7 weeks, and I'm like totally healed inside and outside. But I have a few kinks, but they're not like big, like I'm gonna fall down and die.
But you're a new man.
Yeah, I'm a new man. Like other kids in my class, they're just like down, like I used to be, and they're all like, "Oh, are you okay?" And now I'm at school, and they're like, "Wow, man, you're like real cool now. You're not all like, oh, just don't talk to me." Now I'm talking to everyone, and it's just I have a real good reputation now at my school. So it's like he made the thing that makes your body heal itself powerfuler, and yeah.
That's pretty wild.
Yeah, it was pretty wild that he just made my coughing stop instantly. Literally, instantly.
First visit?
Yeah, first visit.
What did
He just did his magic.
And so what did you think about that?
I just thought that this is impossible. I like, it's just impossible. But he showed me that the impossible can be real.
Video is so powerful and really super interesting. I mean, you get a good warm and fuzzy feeling just watching it. And I know when we watched it together that you started smiling immediately just watching it again. That you could have that kind of result on somebody's life. So how does that make you feel? Like so it must really give you a lot of rewarding feelings to have something like that remarkable happen.
Well, yeah, that's why somebody like me or one of my colleagues would do the kind of work that we do. Is like we want to help people and we want to change people's lives. And when I was feeling bad, I had really bad acne, and then I couldn't think straight, and then I went through chiropractic school, and I was just kind of like a little bit of a mess. And then I got exposed to mold literally for 6 years. I had mold in the gym that I worked out at. I had mold in the office that I was working in. I had mold in the home that I was living in. I had mold in the car I was driving. Every time I went outside and I was not in my car, I felt better if it was like a couple hours, but I didn't feel good. It didn't really, I mean, I could be outside for like 6 hours. It's still like, I'm feeling a little better. And then I'd go home and take a nap and I'd be terrible. Right. And so we want to feel good. Like I was always looking for somebody who could help me. And I found someone with the skills and the training to be able to help me. And, just thank goodness I did that. At the time, I was in a lot of trouble, obviously. And so I want to help people the same way that somebody helped me. I feel like, pay it forward, right? And so that's going to allow you're talking about this being business advice too. So, you got to be passionate about this. It's not like you couldn't get into medical school, so now you want to be a chiropractor and you think everything's going to go great. I think you should just go to medical school or do something else. Don't do this. Only do chiropractic or acupuncture or one of these kind of holistic kind of professions if you are excited about it and you're going to pursue it and make it into a lifelong kind of a thing, that you're excited about. So I feel good. That's why I do the kind of work that I do, because somebody helped me and I got to help other people the way somebody helped me.
So who was it that helped you to kind of get really involved in the?
Well, at first I like I said, I tore that muscle, and then I drove about 2.5 hours to see somebody named Dr. Bruce Shin. So Dr. Bruce Shin is this little Korean fellow, and he had the therapies to help me. He'd learned total body modification, and neuroemotional technique and sacro-occipital technique and all these different healing techniques. And then I ended up moving from Southern California. I went to school at Southern California University of Health Sciences, School of Acupuncture and Oriental Medicine. I know it's a long name. It's also Los Angeles College of Chiropractic. Okay, so I moved from that school to Northern California, to Life West, and I couldn't really go down to see Dr. Bruce Shin anymore. But Dr. Bruce Shin and a bunch of other people were talking about this instructor that I had named Dr. Tim Francis. And Dr. Francis is in another state. He's in Las Vegas. And so I started seeing Dr. Francis. So Dr. Francis was the same person who taught Dr. Bruce Shin and myself. And he even was kind of a student in many of the courses of Dr. Viktor Frank when he was finishing up with his school. And so my original chiropractor, this other lady named Dr. Zaida Rivane, she was in classes with Dr. Francis studying from Dr. Viktor Frank. You know, this was about 39 years ago. I mean, this is a long time ago, you know. So
then if you were, I'm going to shift gears just a little bit. It's too bad I lost that original video.
The Skolnikoff video.
Skolnikoff video.
Skolnikoff video's gone. Yeah.
That was
no. I mean, just am I letting you down here or something like that?
No, it's my own fault.
Was he finally died of? He died of all these different things that I help people with now. He had prostate cancer. See, my father had prostate cancer, and I told him about like Dr. Francis, and I told him about all these therapies, and I said, you know, Dad, maybe I can help you. And he said, well, thank you, son. I'll have to think about that. Let me look into that. And then he died of prostate cancer and a heart disease, and he had problems with his cholesterol. He has a condition that was very similar to Parkinson's disease. And the prostate is related to your entire endocrine system. It's just one of the endocrine glands among all the other ones. So we have the prostate, the hypothalamus, pituitary, the adrenal glands, your pancreas, the pineal gland. You have a lot of different endocrine glands, but it's a system. It's the hormone system. Mm-hmm. And it's just a gland that is kind of near the bladder in a male. And the females, they have their uterus. We're talking about a male though. So, but there's emotions that support and are related to the prostate. And then there's homeopathic remedies that are related to the prostate. There's nutrients that are related to the prostate. For example, the highest levels of zinc in the entire body are in the adrenal glands, and the second highest levels are in the prostate of a male, of course. For a woman, the highest levels of iodine are in the thyroid, because that's the way it is for a male too. But the second highest levels of iodine in the body are in the ovaries. So a lot of women who have trouble with their thyroid, they also have trouble with their ovaries and vice versa. So this is a whole language and science and art of chiropractic and the Skolnikoff method, right? So it's not like you just have, this isn't like some hokey pokey, flowery, rub and pop like a chiropractor and then you hope and pray, or like an acupuncturist. Everything is an acupuncture point or meridian that's out of balance, and all you have to do is acupuncture the point or balance the meridian. Or to the surgeon, every problem needs a surgery to be corrected. But the applied kinesiologist or the Skolnikoff method practitioner realizes that you need to have a big toolbox of tools to be able to address all the different issues that humans have. Humans get depressed. Humans feel elated. Humans sometimes have difficulty with telling their wife the truth about what happened before they met, or they have difficulty with, whatever. They want to exercise more, but they feel like they can't because they have to work to make money, or whatever the case is, right? So all these complex multitude of things that affects humans affects their health. And you can't just go to a psychiatrist. You can't just go to a homeopath. You can't just go to a naturopath. You have to go to somebody who does all these different things, which is why we have the Triad of Health. Should I show that Triad of Health?
Sure. Yeah. I thought it was interesting. I think it is interesting, and it resonates. It just makes sense.
Yeah.
It's almost like obvious is one of those things where you say, oh yeah, and then you say, oh, I didn't think of that.
Exactly. So what happened was my father died of all these diseases, and the hips are related to the prostate. And my father had prostate cancer, and then he had the chemotherapy, and he had um all they were doing was treating the symptoms without addressing what caused those symptoms to be there to begin with. So, you see that on the whole screen, or is it just part of the screen?
Just part of the screen.
Oh my goodness, me oh my. Okay, so I guess I just
There, that's good.
yeah, I don't want to I'll just try to be a good, well-behaved
That's real good.
person for you.
They're very good.
So my father had this problem with his structure, the prostate, which is in his body, and that affected certain joints and bones that are related to the prostate. Medical doctors without extensive additional training in professional applied kinesiology don't know this, right? So when his hips were real painful, and he could barely walk, what did they do? They gave him
an anti-inflammatory, ibuprofen, or something stronger than that. What's the other ones?
They gave him something like that, and they gave him a walker, right? So he could walk with the walker. But they never addressed the cause of the problem. They never even understood that the reason why his hip joints were bothering him so much was because he had a problem with his prostate. Because they don't have that education. They don't have the skill. They don't have the training. Am I putting them down? Well, I could start, but no, I'm actually just explaining that they really do not have that skill, and they really do not have that training. It's just a fact. So I just wish they could have had the skill and training to help, but they didn't. And so he had emotions that he was dealing with that are related to his prostate. And he had all this oatmeal and all of these veggie burgers for several meals a week throughout his whole life, if not more than that. Like almost every day he'd have his oatmeal. Oatmeal is like a magnet for zinc. It just pulls the zinc right out of not just your intestines, but that's what it's doing. It has phytates in it and things that pull nutrients out of your gut. And if you go and ask a medical doctor about it, who has extra training about nutrition, who went to get, this is beyond their medical school training, they'll tell you, well, there's high levels of zinc in oatmeal. Yeah, there are high levels of zinc in oatmeal, and you can't absorb the zinc that's in the oatmeal. So, zinc is not something that you just look at in a slide on a microscope in a lab. Zinc needs to be functionally available at a cellular level to a real live human or other animal who chews a food that has it in it and then swallows it, and it needs to be made available. So it needs to be digested, absorbed, metabolized, and made available. So yeah, that's kind of the example of what happened with my father and his prostate. They nuked his prostate. They did a radiation therapy. Then they gave him the drugs to keep him from making more testosterone, because they realized it was like a proliferative kind of cancer he had developed. He had developed lymphoma as well, by the way. That's the cancer, the lymphoma. And so they didn't want it to spread, so they just gave him this thing to shut down the hormone instead of getting his body to heal itself. But they don't have this. It doesn't mean they're bad. If I'm about to die of a heart attack, or if I'm in, a place like Vietnam, and all of a sudden there's a situation where I got to stop sharing this. There's a situation where I'm bleeding out, my arm's just hanging by a few little vessels and things like that. I want a surgeon, right? I want somebody who can do surgery. I'm going to need morphine. I'm going to need to be, committed to a place where I can get a bed, where they're going to take care of the blood. Maybe they can get me fluids and all that kind of stuff. That's what I want. I want emergency medicine. So conventional medicine should not be called a conventional medicine. It's supposed to be called emergency medicine. The allopathic model of medicine is fantastic. It's amazing. It's perfect for emergencies, but it was never designed and never should have been used for these chronic conditions that a lot of us people in the United States have. The cancers, the heart disease, the diabetes, all this stuff is just chronic, stuff that is not appropriate for this emergency healthcare. So, but my father went to medical school. He was a psychiatrist. He didn't know any better.
Right. Yeah.
He
He
came
had
from the
all that
silent generation. So he
all
didn't
that
want to,
training.
yeah, he was closed to all these different forms of healing that I'm open to. Even though he went to a chiropractor, he couldn't make the connection that, there's something more than the kind of healthcare provider that was a chiropractor that he went to. There's more to it than that, you know? So, yeah.
So if you were to tell somebody who is thinking about becoming a chiropractor right now, what would you tell them that they or a functional medicine provider, or you're something more? What would you tell them to be aware of or to be prepared for?
Well, be prepared for things not, somebody once said, if you if you if you treat people, if you're convicted about what you do, and you have the hands to heal, and you have a good heart, and you provide the therapy, you do it by hand. That's what chiropractic means. It means done by hand. Then people will, travel a mile through, hundreds of miles through fire to get to your doorstep to have you help them. And that sounded really excited. And I believed that that was true until I started into practice and I graduated and I had my degree, which is, worth a little bit less than a Starbucks coffee. And then all of a sudden, nobody wants to come in unless you pretty much pay them to come to see you instead of them paying you. So you have to realize that you're going to run into a little bit of resistance. And if you want things to go well with your practice, you're going to have to create a thriving, busy practice. You're going to have to become a messenger with a message that's powerful, and you're going to have to be convicted. You're going to have to be like Jesus, and maybe you can get 12 disciples if you want, but if you don't have to have those 12 disciples, you have to become all 12 disciples yourself. And for me, the best way to do that was to become very passionate about spending time, money, and energy on learning my trade. And my trade is unusual. It's the Skolnikoff method. Involves lots of different modalities that are entire different professions of, psychiatry, psychoanalysis, herbs, homeopathy, nutrition, flower essences are part of naturopathic, chiropractic, homeopathy, or which is called, they call it the classical homeopathic approach. The classical homeopathic remedies that were put together by Samuel Hahnemann that have been used for a couple of hundred years. See, people, people who are not open-minded enough, they just figure that if it's a prescription medication, it's proven. They don't realize that, it's kind of switching gears a little bit, but I'll go back to the other one. They don't realize that a lot of these homeopathic remedies, they're all proven. They all have proofs. That's how they become classical. That's how they become one of these classical homeopathic remedies. Belladonna is the homeopathic remedy that can often be used for headaches. And more research and more studies have been done on belladonna than any other medical intervention that's ever been available. So people are so confused. They just don't know the truth. They're just being blindsided by misinformation campaigns designed to kind of dumb down the population. So you have to be, better, faster, stronger, whatever, than your colleague down the street who's, offering their spinal decompression program. If you're not excited about what you're doing, you're going to make a lot of money doing spinal decompression, and then you're going to be burnt out in a couple of years, and you're going to want to go on to another profession, or you're not going to be happy. And that's not what I think is a great life. I want to be happy. I want to be healthy. I want to be thinking clearly. I want to be wrinkly and old and in love with my wife and everything's going well, right? And still have money to travel and all that kind of thing. And you can only do that if you're happy about your life, if you're excited. And, we were talking about that. I guess the recording didn't go through, but we were talking about bringing ourselves up on the path on the map of human consciousness that Hawkins had developed. And that was the first image we had that they might have seen watching this interview. So yeah, there's a lot to it, but you need to have a coach, right? Not only am I a coach for my patients, when it comes to their health and even decisions that they're making that affect their health, but I have a coach, and I've paid different coaches lots of money to get help to be a better doctor for my patients. It can be really, really tricky interacting with people who are sick. Really, really, really tricky because they have self-sabotage. They keep sabotaging themselves from being healthy, not because they're not good people or not because they don't really want to experience a better life, but there's just a certain level of confusion in a person's nervous system who doesn't feel well. I mean, when you have headaches or you have neck pain or you have erectile dysfunction or you have depression or you have whatever, diabetes or whatever it is that you have, Graves' disease or whatever, Hashimoto's, whatever, you take your medication for the heart or your blood pressure or whatever, or your thyroid, it's just you're not as clear thinking and you're not as congruent with the things that you're wanting in your life as what you're getting. So it's that lack of congruency that you're relying on incongruent. It's kind of like you have a gauge, right? So you have a gauge, right? Whatever the gauge is, this is just pretend, and the gauge is giving you a measurement and the measurement says 100, but your gauge is off. The measurement is supposed to say negative 25. But you're looking at it and you see 100, but the real number is negative 25. You're measuring your result by the 100, but you're inaccurate. So we need somebody to help bring up your calibration to what it actually should be, which is the number is supposed to show 100. And you can't just keep going through life and expect everything to change if you're looking at 100 when it's really, or you're looking at 100 when it's really negative 25. So the only way we can change all that is you need to work on you. You need to work harder on you than on anything else. It's not that you need to work on your patients or your marketing or your this, your sleep or your holiday weekend or whatever. You need to work on you. And the only way that you can do that is if somebody is coaching you along. Just the way Stephen Curry has a coach, the great famous basketball star. It's not like he's not good at making the baskets. It's not like he's not good at working with the team. It's not as though he doesn't have talent, because he does. But even he has a coach and pays tons of money to somebody who can help him. And many of these really successful stars, they have multiple coaches. There's some musician, I can't even remember his name, but this black guy, he does all this pop music and stuff like that. But he has like all these different coaches. There's coaches who help him with his money. There's coaches who help him with his music. There's coaches who help him with his family. It's like he's paying all this money and he's like the number 3 or 4, pop star in the world for 18 or 20 years. Of course he has coaches helping him. What do you think? He just did all that stuff because he's just much more gifted than anyone else? Stars aren't born, they're made, right? So you have to keep practicing. The reason why.
So what do you do? Say for instance, you're a young person and you just have started your practice, and maybe you went out on your own, or maybe you're going in with somebody, but you don't really have a lot of patience. With the T, patience. You don't really have a lot of patients coming in, and you end up doing these advertisements for a $19 back adjustment, that you're trying to get somebody into, or you're sending a Groupon through. How do you go from that place to where you are? How do you transverse or go across that chasm to get from one place to the next?
Well, I'd love to save people a lot of the headaches that I went through, but I think the way to do it is you got to stay focused on the end result that you're looking for. That's the key to any area of success. And while you're staying focused on that result, you're going to be very careful about, who you're going to follow as a coach. So I got these great, amazing coaches, and I don't use all of them right now, but I had this one company called 5 Star Practice. And then I now use this company. They have a sales training program there as well. They're called 7 Figure Docs. They help with Facebook marketing. And then I wrote a book. I know a man named Clint Arthur, and he's hooked me up with a lot of different kinds of great opportunities. He's sort of like a PR kind of fellow. And so you have to rely on other people. You're going to need to invite other people into your world and into your practice, and you're going to need to get advice. Somebody was telling me years ago, don't do Groupons, but I didn't really understand what they meant. But then I had all these terrible experiences with Groupon and all these people complaining about my services because my services aren't designed to be a Groupon. They're like a high-end service for people who are really, really unwell, but they've had a pretty successful life. They've had a career that's been good. They've worked really hard. They've just been under too much stress. Now they're maybe even thinking about, retiring within 10 or 15 years or something like that. And it's not like they don't have any more health, but they have plenty of money, you know? So
Right.
somebody like that, I can help them. That's kind of my ideal client, although there's but there's different kinds of people.
So let me ask you about your book, because you brought that up. So was there a difference between pre-book and post-book after you wrote the book?
Yeah, there's a big difference because, like I said, we're working on you. So we have to study marketing a little bit if you're going to be having a practice, right? If you're going to be in this kind of a healthcare practice type thing. So there's a book called The Power of Persuasion or something like that. Have you ever heard of that?
Robert Cialdini?
Yeah, Robert Cialdini. So we have to end up studying.
Never heard of him.
You've obviously.
No, just kidding.
Okay. Yeah, obviously you're the one who knows the author, and I can't remember it.
Just pulling your leg.
Yeah. Which one of my 3 legs? Yeah. So we read that book, and then we start to learn, and we have to apply what we've learned. But yeah, when I wrote the book, it was kind of like a dream that it took like 3 or 4 years of writing this book, right? And the book is about the relationship between me and my father who died. And he never even wrote a book, right? He wrote all these articles. He would teach. He was this really kind of fancy kind of a psychiatrist, but an old school psychiatrist, a Freudian psychiatrist. So he wasn't open to even psychoanalytic or psychiatric or psychological methods that were different than his. So there's something called EMDR where you kind of tap a little bit, or you can have a person tap themselves, and it's done by a psychotherapist. And when my brother told him all about this and all about some of the things he was doing with like improvisation, he just said, well, so what's the point? And my brother's like, well, doing improv is fun. And when we tap here, we help the person with their memories and with their mood and everything like that. And so, you have to be like convicted, right? You have to have a story, and your story has to be strong. It has to be powerful. It has to be like, it has to drive you, right? So you need to have like a why, right? Like I can never bring back my father, right? I cannot help my father. And I have other family members who I will never be able to help them, but I can help all those other people in the population, right? So sorry,
It's all right. It's obviously it's a difficult thing to talk about when you felt like you could make a. I'll cut out this little piece here
well,
too.
it's up to you. You don't have to if you don't want to, but
I don't want to, but I just want to respect.
No,
you as a
healthcare providers, we're kind of like touchy-feeling people, right? And we're what's called kinesthetic. So if we're really good at what we do, I would think that if we're using the Skolnikoff method, or even if it's professional applied kinesiology and especially total body modification from Dr. Viktor Frank, we have to kind of sense or feel what's happening with our patient. So the medical doctors sometimes are really, really good, and sometimes the nurses are better than the medical doctors, and they can sense what's happening with their patients. And when the patients are getting to the near end of their life and the nurse is helping them, the dying patient talks to the nurse. They don't talk to the doctor, and they tell them what they want and what's important to them in their lives. And so nurses sometimes are like, they have now doulas and midwives. They've been around for 65 or more years, and they help with birth. And, there's other people who can help with death, but you have to be in tune with your patient. So the patient doctor experience is one that's constantly changing, and it's very much unseen, unheard, untouched. It can't be measured with the usual five senses. You can feel it, but you can't see it, you can't taste it, you can't hear it, you can't do all that. So, same thing with like, when I'm helping a patient with death, sometimes they've had everyone they know die around them. I had this lady who came from Brazil, and her brother died, her parents died, her mother died, her sister had died. She had all these people dying, and so I helped them think, okay, what happened? When was the first person who died, and what was their name, and what did they die from, and what was that like, and think back. And so we'll have all their muscles are getting weak every time we have them think about the death of somebody, whoever that person is. It's not just one person who died, right? And then we have them think about, and then we provide the treatment. And then after the treatment, we have them think about the death of each of these people. And we see all the muscles are strong. So we've changed who that person is, because they went from subconsciously getting weak every time they think about death to now subconsciously and consciously being strong. We took the subconscious and brought it to the surface, to the conscious. Freud understood all this stuff, but he never had any therapies available. So it's great that my father was this amazing Freudian psychologist, but his therapies it would take 6 years to do something that might take me 1 or 2 visits in my office. And even then, he had no therapies. He just had the talk therapy, right?
Mm-hmm.
So you have to look at it like structurally, chemically, and emotionally. I couldn't help my father. I can't help some other family members, but I can help all these people in the population so that, when somebody like me dies or whatever, there's other people who can get help. I mean, most people have never heard of what applied kinesiology is. They've never heard of the Skolnikoff method. They've never heard of total body modification. And they've never heard of a lot of people now have heard of Dr. Scott Walker's neuro-emotional technique. It's taught in the psychiatric as an elective in the psychiatric department at Harvard Medical School by Dr. Dan Monti. But, these are things that are kind of on the fringe of our established status quo of the conventional medical model doesn't really let in the effective healing that allows people to be healthy, because those are not good workers. Those are people who fight and do whatever they want, and they can't be told what to do. They don't make good employees, right?
So let me ask you another question. So if you were,
Get me to stop at some point, please. Thank you.
Yeah, we're just about done. We're almost done.
No, I meant it was like I'm just going off, not about answered your question. But you need to have a coach. You need to write a book. Yeah, and the book needs to be done properly, because a lot of your competitors won't have a book. So that's the main reason why you want to have one. But also, if you're really excited about what you do, you might as well write a book. It may not be easy, or you may not even think you want to or that you should, but maybe you need to do it, even though you don't want to do it. Sorry to interrupt you, but.
No, now I got distracted there. I've got.
Oh, my bad.
That's okay. I should remember it. I'd hate to say. Well, I'll cut this out, but I'm just pulling a Biden here.
I was talking about, when you're doing the healing, you have to be in touch. There's an important doctor-patient relationship that the medical community doesn't really do, right? They just find a part that's not working, and then they can remove it and replace it, like a knee replacement or a hip replacement, or they can provide the surgery, get rid of the tumor, take out the cancer's gone, everything's fine, or they can nuke it with chemotherapy, or they can drug it.
I remember my question now. So have you considered like having some sort of accreditation or something like that on the school? I mean, I know that you get very passionate. I've seen your talks that you've given in Oxford and New York Academy of Medicine, and that you're able to really get in there and make your case. Have you considered doing something like that?
Yeah, I have thought about it, but there's some conflicts there, because I'm using lots of different techniques, and not many people have learned those techniques, and they'd have to learn them first before learning the Skolnikoff method, and I'd have to get permission from all those people, and it's not really. I mean, this is kind of like we're talking about yeah, it wouldn't really work too well.
Multidisciplinary approach.
Yeah. So I teach people little bits and pieces of it. Like I teach other doctors how to help their patients using aspects of the Skolnikoff method that have to do with nutrition and biochemistry and even emotional therapies. But I don't do the how to step by step kind of like thought from beginning to end approach, because it's wow, but it's available though. Yeah.
It's big.
Yeah, it's big.
Okay. So
Yeah,
anything else
Yeah.
that you want to impart is in terms of wisdom for somebody young starting out?
Young people starting out should, make sure that they get their contacts together, and then they get those contacts organized in their some kind of software or database that they want to use, like a CRM. And then they need to start using some kind of a CRM, like Go High Level, or something similar to that. And if they can get good at using Go High Level, and they can start doing Facebook marketing in a way that works for them, maybe they should learn how to do it on their own. Ideally, that would be a really good idea.
Mm-hmm.
And they can somehow work on getting their presence active on social media through the use of people who can help. All these things are really important, right? So it's like there's kind of like it's holistic. I mean, running a business is like running your life. You got to look at all the different facets of it. So plan on it being a kind of a long-term journey. But yeah, you got to get started with the foundation. The foundation is going to be your contact list, staying in touch with them, sending out a newsletter, and then you're also going to want a way to contact them in other ways. That's why something like Go High Level would help with texting and phone calls, and you're going to need to do all that. And the other thing is build your foundation, which is your training and your skills, and you put the time, money, and energy into doing that. I think that the professional applied kinesiology and the International College of Applied Kinesiology is great. They're a little bit old school, kind of like my father was old school, but they still offer all of the teachings of Dr. George Goodhart, who learned how to use muscle testing to actually help people to find out where the problem is, what the problem is, and how do you get rid of the problem and keep it from coming back structurally, chemically, and emotionally. And we can also then take it a step further and learn the total body modification that's still taught by Kevin Millay, who got the company from Dr. Viktor Frank, who's no longer with us. And and so you can learn some of those basic techniques. You can attend neuroemotional technique seminars from Dr. Scott Walker. He was and is a chiropractor. He's kind of walks with a cane now. It's really funny. These guys, when they're getting a little older, they don't give up, So if you want to be like getting like really great results, you have to offer really great therapies. I mean, don't expect like some magic to take place without your being the magic that takes place, right? Be the change.
So how do you balance I'm going to shift just a little bit back to where you were. How do you balance the marketing part of it versus the doctoring part of it? So, because there's only so much time to go around that it's really hard to, because everything takes time.
Well, that's the same thing as like, how do we balance our health with our career? It's like you balance the marketing with the doctor part of it based upon what's your a priority to you. I think that your patient is your key to success in this form of healthcare that I'm utilizing. I'm not disrespecting other methods and whatnot, but if our focus is on the health and well-being of our patients, then we're focusing our energies and efforts on our skills and training. But you got to be able to interact with the patients in a way that they feel comfortable with. And that kind of takes clinical experience. It may not happen in 1 month or 3 months. But if you happen to you can just go to a hospital and you can start working and you can start doing rounds at any capacity you can think of, however they're going to hire you, like an assistant to a psychiatrist or something in a hospital, psychiatric hospital. And that'll give you such incredible training that, assuming you don't get depressed from working in the hospital, you're going to be way more compassionate with all of your patients, and they're really going to love you. Some people who do really well with this kind of healthcare they've first gone through school and become psychologists or psychotherapists, and they didn't like it. And then they became chiropractors or they became acupuncturists or something like that. But because they're so good at listening to their patients the way only a psychologist or psychiatrist or a psychotherapist can do, their patients feel heard and they come back in and they're happy, you know? So I just think it's like, to really make this thing allow for a better world, you have to allow for a better patient. You got to start with the patient. And the only way you can do that is if you're really good at helping that patient with their health. You have to get results for your patient. You can't just fake it. You can't just try. You can't just pretend. You can't just get the spray, potion, lotion, or new CBD product. You really need to learn the skills and get the training that you need to be able to provide the therapies to help your patient get better, stay feeling better for as long as possible, and know that even educate your patient as to what's going to cause them to feel bad again. I mean, I send every one of my new patients like 4 videos and 6 emails about how they're going to be feeling for the next couple of days. It wasn't easy setting it up to automate sending them all those videos and email. I mean, it didn't happen by an accident, you know?
Right.
But I'm doing that because I wanted somebody to do something like that for me when I didn't feel well, you know? So, you know, but it, you know, no, this isn't for everyone, but at least you can just get your marketing in place, you know, get a coach, feel comfortable with the coach. If you don't like them, get another coach, pay the coach, pay them money, pay them too much money, do whatever you need to do, but monitor and measure your results as well. If you're seeing, let's say, 20 people a week, measure the 20 people, measure how much money you're taking in, chart it out, take statistics, and monitor your progress or lack thereof. Because if you're not measuring your improvement or lack of improvement, then you're just kind of like, you know, you're just kind of like a ball bobbing up and down upon the water that's going up and down with the waves or something like that. So you need to kind of really measure how you're going along as you go. Yeah.
Well, I think this is my longest podcast ever for sure.
Oh, great. I've heard that before.
Thank you for joining us on The Holistic Entrepreneur. Visit our website at holisticentrepreneur.org for more resources and information about today's guests. Subscribe wherever you get your podcasts. Until next time, I'm Zane Myers, and we'll continue exploring the intersection of holistic health and entrepreneurship.